Okay, I don't think anybody new is on, so we're going to jump right to the questions and get started. So here's question number one. Another practitioner is pushing for me to do mistletoe. Um, I have heard good things, but not sure if we can financially swing it right now. With the protocol you have me on, do you feel we can restore my health in time? So I think this person is choosing to do chemotherapy as well. So I don't know that I would add mistletoe at this time. So yeah, I think this might be actually an older question too, but I think this is something that you could forego right now. This isn't something that I don't think you need to do. Go back to my oncologist of the week. Is there an alternative treatment for Zometa? So Zometa is the drug that is an injection to for people who have metastasis to the bone. So so I've spoken a lot on this in the past, and I am very much um, not a fan of this drug. So I can't tell a person to take it or not to take it, but I'm not a fan of this drug because of the studies on the drug itself. They're just so unfavorable, but they continue to use it, which is kind of mind boggling to me. So here's the deal with Zometa. So when it first came out, it was a drug for osteoporosis. So if you have osteoporosis, they put you on Zometa, or I can't remember what the other brand name at the time was. It's an older drug. It's been out at least 15 years. And it was just this great promise that it's going to help women with osteoporosis, because if you have osteoporosis, you have weakening of the bone, and then you end up with pathological fractures. You know, you might have a mother who had a hip fracture. Well, a person who has a hip fracture didn't fall down and fracture their hip. Their hip fractured, causing them to fall down. And their hip fractured because the neck of the femur is the weakest part of the bone of the weight bearing part of the whole femur, that neck of the femur. And the the strength of a bone is in the inner part called the endosteum. The outer part of the bone is called the periosteum. Peri means outer, end means inner, endosteum. The inner part of the bone is really where the the density of minerals are, and that's what gives the strength to the bone, the endosteum. So if I have a lytic um, destruction of a bone due to cancer, it will start eroding away the periosteum and then the endosteum, and that's not good because that can cause um, weakening of the bone, and if it's a weight-bearing bone, you can end up with a pathological fracture. If I have metastasis to a rib, um, the chance of me having a pathological fracture because the ribs aren't weight bearing are slimmer. Though you have a lot of muscle pull on a rib, and you can fracture a rib, but it's more so you'll more so get a pathological fracture of a rib if you like hit it, if you fall or you bang it against something. When you can have pathological fractures are going to be um, due to metastasis to bone, are going to be in the spine, can be in the hip, but usually you don't have metastasis to the femur of the hip. So you typically won't have that. You get metastasis to the pelvis, which it's a very big and dense bone. The chance of you having a pathological fracture there is pretty small. It's really the spine that you're worried about. So whether you have osteoporosis causing weakening of the bone and then possible pathological fracture, or you have metastasis, you want to try to strengthen up the bone. Well, how do you deal with when you have metastasis of the bone? Well, you have to try to attack the cancer so that the cancer stops growing, right? That's number one. And then from the medical doctor's perspective is, hey, we have this drug that was approved for osteoporosis, this Zometa. Why can't we use it for metastatic cancers when you have mets to the bone? Well, great, we'll start using it. The problem is the 5-year studies, which came out about 10 years ago on this drug, showed that women that used it for osteoporosis had no less pathological fractures than women that didn't use the drug. What the heck? Well, that's what it was trying to prevent, is pathological fractures. Well, all the studies, and you could Google this, Google these studies. All the studies show that all it did is increase the density of the periosteum, not the endosteum. So even the authors of the study said that it literally is like wrapping saran wrap around the bone. So it's causing the periosteum to become harder and actually, in their words, more brittle. And it's preventing calcium and minerals to get into the endosteum. So it's causing a hard, brittle, cellophane wrapped or saran wrapped periosteum, which the periosteum doesn't give the strength to the bone. Therefore, it doesn't actually prevent pathological fractures. Well, why in the world are they still using a drug to prevent pathological fractures when it doesn't prevent pathological fractures? Because there's a whole lot of money in it. And I don't mean to be cynical, but I am just totally against Zometa and the other brand names of this drug. It does not increase the density of the endosteum. Actually, it prevents the increase of density of the endosteum because it wraps a brittle, wrap basically of calcium around the periosteum, sealing it up. Your bones are a living matrix, and calcium is going in and out of your bones all the time. That's what helps balance your blood. That's part of your buffering system, so you don't become acidosis. It steals calcium from the bones. Calcium is going in and out of the bones. You have osteoclastic and osteoblastic activity constantly. So I personally would not do Zometa. I would not use any of those class of drugs. Even if I had very serious metastasis to the bone and weight-bearing bone, I would not do it. And then I would do radiation to the bone to kill the cancer if I had serious metastasis to the spine. I would not use any of this class of drugs. Do you have to be on hormone blockers with breast cancer treatments? I really hate to go back on either one of these. Well, hormone blockers with breast cancer, if you have really aggressive breast cancer, has been shown to decrease it. So I would say this, I know who asked this question. I would say, yes, you should go on that. This is the same person asked this question. I would say you need to do your studies on the Zometa. Personally, I wouldn't go on that. But personally, I think this might be a right thing to do right now. I was tested for Hashimoto's about 27 years ago and had the antibodies. So Hashimoto's is when you develop antibodies to the thyroglobulin cells. So you got thyroglobulin antibodies or thyroglobulin peroxidase cells, which are TPO antibodies. So those are two different antibodies that you would test in a person's blood. And if they were elevated, you have Hashimoto's. Well, you have either Hashimoto's or Graves' disease. So if you have spiked T3, the strongly elevated T3 with elevated TPO or thyroglobulin antibodies, then you have Graves' disease. If you have normal or low T3, then you have Hashimoto's. So it's very common in Hashimoto's. So I hadn't been tested again until last May and did not have any antibodies. The doctor told me that I either never had it or I had it under control very well. Just recently, I read that if you have a cancer diagnosis, these antibodies don't show up. Is this true? No, I don't think that's true. I've never read anything about that. It is if you have your Hashimoto's under control, your antibodies can go back down to normal. So if you ever had elevated antibodies, you definitely had Hashimoto's. But remember, autoimmune disease is diagnosed in 3 phases. So if you have elevated antibodies, but you don't have any really bad symptoms, so it just shows up on blood work, meaning, so if you're diagnosing autoimmune disease, showing up on blood work where you don't have any bad symptoms and you don't have any tissue destruction, that's in what's called silent autoimmunity or phase 1, stage 1 autoimmunity. And that's probably what you were in. And you can get that under control and you can put it in remission. So you can't cure an autoimmune disease, but you can put it in remission for a long, long time. So that's probably what's going on. When you were diagnosed with cancer, you made a lot of dietary changes, you made different lifestyle changes, and that can really calm down an autoimmune disease too. So that's good news. Listening to a podcast that said cancer is just parasites. If you clean up the parasites, you can restore your health. What are your thoughts on this? Well, I totally disagree with that. So, and I would be careful listening to anybody out there that says dogmatic statements like that, because cancer is, every different type of cancer is really a different disease, number one, and has different causes. You could have a twin brother that has the exact same cancer that you do, and it could be, totally different cause and totally different way to correct it. Whenever you see like, oh, cancer is just a fungus, somebody wrote a book on that too. Cancer isn't even a disease, it's just a fungus and you have to kill the fungus. Well, it's just, to me, those are just showing a person's ignorance. I don't know, sorry, but totally disagree with it. Can parasites be a part of your ill health? Well, sure, you can have parasites be a part of ill health, no matter what kind of disease process or symptom pattern that you have. So you do want to address that too. I've been reading that beta-glucan is very good to help kill cancer cells. If so, is there a brand you would recommend? Maybe it is in something I'm taking. I just don't see it in the ingredient list. So beta-glucan is a polysaccharide. So polysaccharides are probably my favorite thing to help stimulate your immune system and kill cancer cells. Because where do you find polysaccharides? So polysaccharides are in mushrooms. Polysaccharides are in aloe. And different chains of polysaccharides do different things. That's why using different mushrooms can be beneficial. The Aloe Vera Immune product that a number of people are on, that's a certain chain of polysaccharides. I think it's around 300 to 400 chain saccharide length. There's different chains of polysaccharides that are in chaga mushrooms and a little bit different chains that are in turkey tail mushrooms. So you can also get polysaccharides, and beta-glucan is just another polysaccharide. So beta-glucans are a polysaccharide that are in mushrooms. You can also get beta-glucans from other sources as well. So if you're taking a mushroom in anything you're taking, you are getting beta-glucans. If you want a pure, just straight beta-glucan, my favorite now is the US Enzymes beta-glucan product. I think that's called Immunozyme. That's a good beta-glucan product. So if you want to take another supplement, I would look at that. During my phone call with Dr. Connors a couple weeks ago, he told me to send in another cheek swab after my surgery, which was on Thursday, April 6th. So it's April 19th now. So I just don't recall if I could send it in immediately or supposed to wait a certain time. So if your surgery was on the 6th and we were 2 weeks past, go ahead, time to send that in. This would be a good time. I just read an email that you sent about genetics, protein, and cancer. I had my genetics done with you, and I'm wondering how I can find out if I should be eating protein or not. I do have the MAT gene defect, and and was told to be on a low methionine diet, um, or the PDH gene defect and be on a low carb diet. Um, so if you want to schedule a time with me to chat about your genetics again, if you can't find the genetic readout. Now, this person did a genetic workup with us. You know, this person started with us a long time ago. So I'm pretty sure we weren't doing the same thing that we're doing now. As far as now, we give a uh, we give you the whole report, which now is like 250 pages. And since that's so hard to digest, we give a genetic summary report, which we have printed out, and we highlight the genes that we think are the ones of concern. And that is about, I don't know, 15 to 18 pages. And then you really only have to look at the highlighted genes, which might be only 5 or 6 genes that are really a concern. And now we also give a genetic action step report that is like, okay, really that's the only thing you really need to look at, unless you want to, dig in a little bit deeper with the summary report, or if you want to totally geek out on the full one, and then follow that along with going to the Read Your Genes course and watch all the videos that Ann and I have created on the genetics through the Read Your Genes course. So, but if you just want to know, hey, I just want to know if I have this gene defect and I can't figure it out looking at my big report, then call and schedule a time to go over it with me. Just try to have your questions organized, because it can be a lot of meat to go through, and I don't know how much time you want to spend on that. So, Dr. Cutters, do you have any recommendations for intermittent fasting and food combining? What should a breast cancer patient eat? Proteins, carbohydrates, grains, and fruits, and when? So you should eat what we recommended you eat on your cheek swab test. So if your cheek swab test, we told you to stay away from dairy, which is common for breast cancer, then, and that was, let's pretend, to make it simple, that was your only restriction, is to stay away from dairy. Everything else, nothing else was a driver. Let's pretend only dairy was the driver. Well, then we give you that whole green section, because not everybody's familiar with, we got to try to eat organic, and we got to stay away from sugar, and we got to, all the other things that we ask you to limit and to be careful with. And then there is another stage. There's a step everybody could go, because we're only testing the cheek swab, and it was the only way to do it is to test. We lock into cancer and then see what I think is a driver, or what I think you should be staying away from for cancer. But there's no way to test whether you, with the cheek swab, whether you have antibodies to other foods. That's why I'm so excited for my cancer patients to go and look at the new course I have on autoimmune disease, because that goes into depth on my teaching about looking at why you'd want to look at antibodies to foods as well. Do I have self antibodies? And I wrote way back when I first wrote my first writing of Stop Fighting Cancer, Start Treating the Cause over 10 years ago. I wrote that I believe cancer has an autoimmune component. And so that's why I've been just so driven to study autoimmune disease, and all the latest information on autoimmune diseases is in that course. So so the next stage, let's say, okay, I tested, I've been staying away from dairy. To get back to this question, what else could I do? I'm still having other health issues. Maybe it's not even related to the cancer. Well, the next step is to do some antibody testing. And it's in that course, in the second module, where you start digging into what other testing should you do. You could test for like there was another question about parasites in here. Is that person obviously may be concerned with parasites. You could do parasite testing. We could do stool parasite testing. We could do, which I think would be more common with cancer issues, is mycotoxin testing. Mycotoxins are from mold, so mold exposure. We could do glyphosate testing, which is probably the most common with cancer. You're exposed to pesticides and herbicides, and that'd be something to look at. Now those things just tell you, what things that we need to continue to work on to detox. We already know those things, so there's no need to do those testing. The deeper thing that I'm talking about is do antibody testing to other foods, because I may be, gluten might not be driving my cancer, but if it's driving an inflammatory state, that in a very secondary, tertiary way could be driving a cancer or driving any other disease. So looking at antibody testing, whether you do a Cyrex 2, 3x4, or a Cyrex 10, those are food antibodies. Looking at tissue antibody testing, which is a Cyrex 5, and this is going over most people's heads right now if you haven't looked at that course. But I go into detail why you'd want to do those tests. And I know it's a lot of meat in that course, but if you could plow through that stuff, and I'm adding stuff to that course all the time, if you can plow through that stuff, it'll really help you understand, wow, maybe this is the next step of what I could be missing. And that could be another piece to my cancer. Remember, cancer is very complex, and it's multifaceted. So if I could deal with it as many different facets as possible, I'm going to have a better success. So make sure you take the time to look at that if you can. Dr. Connors and all at the clinic, thank you for your work. I have not been diagnosed or told that my breast cancer has metastasized to my bones, but would it be helpful for my wife to be programmed for that just in case? Yeah, you can. I mean, yes and no. I mean, if you had no clue and that it was metastasized, and you had no inkling that it would be, do we really need to add some bone building frequencies and such into there? Well, we're stealing a little bit of time away from the cancer killing frequencies. So I don't put bone building frequencies in everybody's program if there's no known metastasis. If after I talk to that person on the phone on their case review, or you send in a cheek swab and we had a communication link that we think the cancer is growing, many times I will test with the cheek swab and I'll change that person's program. So that's why some of you may have gotten a flash drive when you get your cheek swab test done, because I tweaked the program. And many times it's because I put some metastatic frequencies in there to help with bone building or something like that. So, but just as a preventative thing, maybe if you feel in your heart that maybe that's what, how God's kind of leading you, then I would say there's nothing wrong with doing that. So, but if that's not in your mind at all, and you're just thinking, well, you're just asking the question, then I'd say maybe wait on it. Also, I've elected to take EstroClear, AromaClear, and sulforozyme instead of letrozole, which is, again, the aromatase inhibitor drug, which letrozole has caused my bones to ache and my eyes to become so dry that it's putting eye drops in my eyes all day long. Yeah, there's a lot of side effects to the aromatase inhibitors. My question is, how much of each should I take? Okay. So I'm just looking at this question now. So really, I'll have to email you again. I should have made a recommendation. So you should look at your email, back at your emails. If I made those recommendations to take those things, I made recommendations for the numbers to take. But I'll look back and I'll try to remember to email you again that if I didn't do that. I also mentioned before that I take the ingredients out of the capsules so that you're not getting the cellulose of the gel caps. Yeah, that's good. Also, where is the best placement for my Rife bulb during the night? Well, if you have breast cancer, it's right up by your chest, by your abdomen. That's the best placement, really, for almost every cancer. So you're snuggling with that bulb. How far away from my body and how near to the breast? Again, the closer it can be to you, the better. Now, certainly, some people are like really bothered with the bulb next to them. It just bothers them. It keeps them awake. Well, that's where buying the amplifier from TrueRife can be a benefit. That you could put the bulb under the bed. So that's another option for people, for the few people that bothers. Okay, questions that came in here. If someone is trying to eat a low histamine diet, is it okay to use the chocolate flavored greens first, or is that problematic? Um, for what you're getting in a scoop of the greens first, how much cocoa you're getting in there, I don't think that's a problem. I don't think that's a problem at all. There's not that much histamine in that. I had the same question as Deborah. I really dislike the mint flavor greens first. Yep, we get that. I understand that. I personally like the mint flavor. Some people hate mint. My son hates mint, so he uses the chocolate flavor when he does it. So, um, and it's nice that they, the chocolate flavor is the same price because it's, if you felt the weight of the two jugs, the chocolate flavor is twice as heavy. So, is there another brand that's just as good? There's a lot of brands of greens out there, and believe me, we wanted to private label our own greens. Honestly, the other stuff that I've tried either just doesn't have the same amount of stuff in it, and or it's just so awful tasting. So we just, when a company comes out, hey, they send me a bottle of their greens, they want me to try it. And I just have stayed all these years, we've stayed with greens first because I just think it's the best product. So again, I'm trying to use the best product for everybody, not just because we can private label. We're trying to private label only the best products. So Greens First doesn't allow private labeling. I'd rather use the better product. So is Birdman vegan protein powder okay? I don't know. I don't know what Birdman vegan protein powder is. I could look it up here. But hold on. All right. Birdman Falcon Chai, is that what it is? Birdman, I've never seen this one. It's a blue with Birdman Falcon Chai vegan protein powder. Interesting. Um, looking at the reason why I recommend the US enzyme protein powder is that it's low in glutamine, and it's hard to tell how much glutamine is in this. At least the label that I have is from whoever selling this is not very good. I'd have to do a more deeper dive on that to give you a better answer. Glutamic acid listed on protein powder is the same as glutamine. Yes, it breaks down to glutamine. Yes, it is. Reading your email this week on glucose, glutamine seemed like going light on glutamine was a good idea. I have not been told to restrict protein in my diet. Should I be worried about it? So I recommend that anybody with cancer never takes excess glutamine. Why would you take excess glutamine? Well, if you're using a lot of protein powder, um, you're going to get some glutamine but if it's a balanced protein powder, you're not going to get a ton of glutamine. Where you're going to get the most glutamine is in a supplement for your gut. So gut healing supplements are going to be very high in glutamine. The amount of glutamine in this Birdman powder most likely is maybe 300 milligrams, most likely, maximum. Maybe far less than that. But there's gut healing products that are very high in glutamine purposefully. Why? Because glutamine drives growth. And that's why it can be really, really good to heal your gut quickly. It drives growth. Glutamine is what epithelial cells really feed off of. So it can really help heal the gut, because damaged gut, leaky gut syndrome is because there's a gap in the gut epithelial cell has died. So you're really reproducing gut cells so that you can heal those wounds in the gut, those tight junctions that have been opened up because of damaged gut cells. So, well, it makes sense. Well, why shouldn't everybody be on glutamine? Because glutamine drives growth. And if you have cancer, you certainly do not want to drive growth of any kind. And secondly, there's other negatives to being on a glutamine product too, that has nothing to do with cancer. So if you have a lot of GAD gene defects, then you are going to convert glutamine to glutamate quite readily. And glutamate is an excitatory neurotransmitter, and that can cause muscle twitching, muscle spasms. But more serious than that, it functions in the brain as an excitatory neurotransmitter, which causes an increased anxiety, increases ADD, increases ADHD, and goodness sakes, we kind of have an epidemic of that in our society. But it's partly because the food processing companies put glutamates in the food, because glutamates fire on receptors on your tongue, excitatory neurotransmitters in the brain that cause an increase in uptake of excitement in the brain. Literally, you can see on a functional MRI, your brain just literally light up when you put glutamates on your tongue. And that actually makes you think, ooh, this food tastes so good. So the pleasure that you get from eating something with a lot of glutamates is increased. You get this excitatory spike, kind of like a dopamine spike that you'd get from, reading your emails or getting a runner's high. You could get this glutamate spike, but it can be very damaging to the brain. It can actually cause an increase in glutamate receptors on your neurons that never go away. And you can really cause a lot of damage. And this person can be then very prone to, anxiety and OCD tendencies. That is literally what OCD and anxiety is really a glutamate issue 99% of the time. So adding exogenous glutamates are causing this issue and making it even worse for these people. Adding exogenous glutamine, if you have there's several different genes, GAD genes are just one of them, you will break down glutamine, the amino acid, into glutamate quite quickly, way faster, and you will spike your glutamates as well. So there's some benefit to using glutamine in a nutritional supplement if you do not have cancer and you have leaky gut. But still, even that, I would only do that a very short period of time. I personally, so if I have a non-cancer patient and they have leaky gut issues and we're going to try to heal their leaky gut, I will use our Clear GI product. And that is got glutamine in it, but it's got a whole bunch of other slippery element, a whole bunch of other really good nutrients to help heal the gut. But it's got less than a gram of glutamine. So a lot of gut healing products will have 4 or 5 grams of glutamine. I think it's very dangerous playing with that. I just don't think it's a good idea, even if you don't have cancer. And a lot of people have cancer, they don't know they have cancer, then they're just like pouring fire on the cancer, gasoline on a fire that they don't even know is burning. So it's very dangerous. Okay, finish this question. Are seaweed enemas good? Well, I am going to say no to that. So seaweed is going to be very high in iodine. And, I'm all for using iodine for a short period of time with breast cancer. And especially topically, it can be beneficial. But long-term iodine use is going to, definitely affect the thyroid negatively. And so go back to the autoimmune course, go to module, I don't know, the last module, the module on Hashimoto's, and you'll hear the truth about iodine with that. I don't know if I would use seaweed enemas. I'll look more on this Burn Man chocolate thing. What combination do I order if I want to take fenbendazole for parasites? What combination do you order? So if you're going to use some fenbendazole for cancer, typically you're using only a packet of that a day. And certainly that can be good for some parasites. If you really think you have parasites, we have a new product from PHP called this is our new ParaClear. It is just, you look it up on our website, the ParaClear. I've used that product before we had a private label. It's the same thing as the Proverbifuge. That's just been our favorite parasite killer. Parasites are super, super common, and non-cancer patients can have issues, and it's parasites. So we use that Proverbifuge. I would look at that. Before I would go on even fenbendazole for parasites, I would do an herbal. Glutamic acid, yes, I talked about that. Is taking glutamine seemed to be light on the glutamine. Yeah, so you're going to get glutamine. You need glutamine. It's an essential amino acid, but you don't need excess amounts of it. So you're going to get glutamine in your meat and your vegetable protein. There's nothing wrong with glutamine. It's just that excess amount, that spike of glutamine. You're taking like 3 to 5 grams of glutamine in a product. I think there's danger in it. I don't have any of you doing that. So I just actually had a cheek swab from somebody that has started with us a long time ago and has not been in contact with us for a long, long time. And the person was doing glutamine, and it's like, what? Who told you to do that? Not us. It wasn't our product. We don't even have a product with high glutamine in it. So, well, we actually do, but we don't carry any. If I choose to do vitamin C IVs, what milligram do I start with? So you'll want to take the advice of the IV center, but they're going to push you to do high dose. I don't think it's ever good to start there. So if you can start with 20 grams, it depends on, so they buy the packs in certain milligram sets. So it might be a 20,000 milligram, and then they'll go to 40, and then they'll go to 60, and then they'll go to 80, or it's 25 to 50 to 75. So it depends on how they have their sets. So I can't say do 15,000 or 15 grams if they don't buy bags of 15 grams. The lowest they have is 25 grams. Certainly do not start more than 25 grams, and you work up to 50 to 75 grams. Partly it depends on your weight. So, if you're, 140 pounds, maybe the most you're going to do is 50 grams. If you're 240 pounds, maybe you'll go up to 75 grams. I've had people that said they're higher than that, but I don't think there's any evidence that that's necessary. This Sun Warrior protein is pea protein. It has 2880 milligrams of glutamic acid. Yeah, that's too high. So that's, in my opinion, too high. First of all, you have to ask yourself the question, why are you taking protein powder? So that'd be my first question to anybody who is asking a question about protein powder. Why do you feel like you need to take protein powder? I personally have never felt like I needed to take protein powder. And protein powder is not the thing that's going to make you gain weight. You don't gain weight because you eat a lot of protein. If the only reason I would think that a cancer patient should take protein powder is if they're getting a lot of muscle loss. So if they're in a cachexic state and they're getting a lot of muscle loss, then taking a protein powder might be a good option to do. So if they're not getting muscle loss, then I don't think, if you're eating well, then you don't really need a protein powder. Remember, if you're getting muscle loss, you have to watch my video on cachexia and look at the blog post on cachexia, because you need to be doing some weights. You need to be stimulating muscle growth. So muscle is only going to grow when you ask something of it, when you're calling action on that muscle, which is you're using it. So if I'm so sick that I'm just laying in bed and I can't do anything, you're going to have muscle atrophy. Even if you're taking protein powder, you're still going to have muscle atrophy. So the only way that you could not have muscle atrophy is you need to use the muscle. So you could be using the muscle and lifting weights and still have muscle atrophy, meaning you're still losing muscle cells because you have cachexia. The cancer is just gobbling up anything you have. That's when it, to me, is appropriate to take protein powder. So if you just had surgery and you're going to be on a protein powder, and still I wouldn't. If you're eating well and you're eating fish and you're eating meat, if you're a vegan and you're not getting any vegetable protein either, well, then maybe you have to, because you're on a diet that's restricting protein. Then it's maybe appropriate, but then it kind of defeats the purpose of your diet restricting protein if you're taking protein powder. So, but if you're still just trying to, I'm just trying to restrict animal proteins, well, then I can't get enough in my diet of vegetable protein, so I'm trying to take protein powder. Well, I guess there's reasons for this. So everybody's different. You gotta weigh this out. He had muscle loss. This was before the treatment. We have to start from square one once he can eat solid food again. That's right. So he can't eat that. So you're getting protein through a powder. I would look at the US Enzymes protein, has a much lower glutamic acid content. Dr. Connors, what is your breakfast or lunch daily? Well, some things I just don't disclose. No, just kidding. So it depends. So if it's a work day and I'm going to work, typically I do not eat breakfast. So I try to do intermittent fasting, but again, I'm not like stick to it on anything with that. If I'm going to be at home and I'm going to be out working in the garden and it's in the summertime and I'm going to be busy, honestly, if I'm busy, I just do not have hunger. And when I get hungry, it's because I am sitting around not doing anything, or I'm at home when it's in the middle of the winter. I tend to put on a weight in the winter and then I lose it in the summer. So I have about 30 pounds to lose right now. So I am hopeful that when gardening season starts, which we had some really nice weather a week ago, and now it got cold again, I'll be out burning these calories because I just will go out work and I'll just work all day outside, and my wife and I don't come in till it's dark, and because we just love doing that. So um, it's sometimes I'll go without breakfast and lunch, and I have no problem with that because I need to burn calories, and that's my intermittent fasting day. So that's my time restricted eating day that I'll eat when we get back in the house. Um, but every day is not the same. For me, every day is very different for me. So there's times that I'll eat breakfast. If we're doing something and we're together, we might have eggs. In the winter, I like to eat oatmeal. Um, uh, but yeah, that's typical breakfast, and lunch varies completely. How often do I do vitamin C? I weigh 96 pounds and I'm 5'1". So again, if you're going to do vitamin C IVs at 96 pounds, you gotta ask them for a bag. No, I would be careful starting at any more than 20 grams. Um, and I would probably only start once a week. So you're pretty teeny. With glutathione, yep, you could use glutathione. Transfer factor for cancer patients. Yes, try to remember what it is though. There's and the confusing part for me on trying to recall that is that there's a number of supplements that are called that are transfer factor two. So I'd have to dig into that again. I don't know if I've ever written a blog on that or not. Yeah, I don't know. I don't know. I'll have to look that up again. I apologize. Thoughts on ozone IV? Um, I'm not a big fan of ozone IV for cancer. I don't think that is I don't think there's anything negative necessarily with it. Um, but it's to me, ozone IV, or the benefits of that is if you have like Lyme disease, so a bacterial infection, that seems more appropriate. All right, thank you for that link. I will look that up, what that is again. How to decrease cancer that may have been fueled in the past month by the glutamine in the protein powder. Um, so um, it's pretty hard to say that, oh, okay, I was eating poorly this past month or something. Could that have made my cancer grow really crazy? There's just too many factors to like point the blame at one thing ever. So um, I'd be careful not to do that, first of all. So let's say, you know, let's say a person's cancer grew really quick, in the last 60 days, and they go, oh, I've been way off my diet. That's really it. Well, you can't say that. You just don't know what factors are involved with growth. It's not always diet. It's not always why I was eating glutamine. That's the reason. So don't get me wrong, and don't just because I say you shouldn't be eating glutamine if you have cancer doesn't mean that it's going to grow like crazy for a person that has cancer. That is not necessarily going to be the causative factor of that. So just you can't take that dogmatic and exact. There's not a perfect scenario there. So don't beat yourself up about that. I'm just saying this. We got to use wisdom in all our decision-making processes. And if I have a cancer, I'm not going to be taking an exogenous glutamine powder, that could be a fuel source, right? I'm just going to be wise. It's just like, okay, if I have a cancer that's growing, I need to clean up my diet. But to be honest, I have patients that some of you might be in this category. I don't know, but I've had patients over the years that have come to me and say, hey, I'll do the right thing. I'll take a few supplements, but I ain't changing my diet one iota. I just want to let you know that. Typically, it's a guy. And it's like, goodness sakes, they got better. So it's like, so is diet important? Yeah, I think diet's important. Is it, always important? No. So it just keep that in mind. If you do have cancer growth over a period of time, how can you do everything you know what to do to put the brakes on it? That's the answer to that question. Don't start, second guessing yourself and beating yourself up and blaming yourself and, you know, blaming a practitioner that put you on something or don't. I just think there's not health in that. So go, okay, it is what it is. I'm going to learn something new. And when you learn something new, you try to apply that thing new. You don't go back in time and cause guilt and shame or anything else that could be doing. So just make sure you're not doing that. Where can I get Rick Simpson oil that is good quality? It's all over now. So you can get Rick Simpson oil in many states legally. I know you can get Rick Simpson oil in a lot of the dispensaries in any legal state, but might have to go there. There's places online that you can get Rick Simpson oil through Facebook. There's some Facebook pages on Rick Simpson oil. Just search for those too. If you go to some of the Facebook cancer groups or some of the other cancer groups that might be in some of the other chat, what do you call it, apps that are out there, there's people that are nowhere to get Rick Simpson oil. So we cannot legally supply Rick Simpson oil. So any other questions? Okay, well, thank you guys. I'll be praying for you, and hopefully it's sunny where you are. Get out and bake yourself in the sun. Enjoy life. Always when you're stressed about your cancer and stuff, I'm reminded of the cases of, like I said, some patients that I've had over the years that have just said, they're just going to do everything they can do, and they're going to just leave the results to God and trust Him. And that's what I want for all of you guys. So just try to live that life as best you possibly can. Know I'll be praying for you. Ask God for the peace that passes all understanding in all your decision-making processes. And I'll see you guys next week.